Hey guys, welcome back to WODdoc Project 365, episode 1215. Guys, if you're following along on YouTube, please jump on over to the WODdoc.com. Check out all of our full-length episodes. That's where we house them. Today what we're talking about is a possible cause to this inside knee pain, right? Medial inferior knee pain. So that would be pain that's on the inside, bottom portion of the knee. Now, if you're a person that spends a lot of time in a desk or in a seated position and you have inside, medial, inferior, or bottom knee pain, this could be a possible cause. What I want you to do is actually go to the opposite side, the lateral portion of the leg, right, the outside. And I want you to feel for any tight or tenderness on the way up and down the thigh, particularly that last or distal 1/3. And if you were to go, see like how that hamstring comes in right there, basically from here to here, right? If you do have some tenderness in here, it can be associated with some of these tight, what they call a tight iliotibial band, right? Which probably comes from tight TFL or tensor fascia lata. But in any case, what we're going to try to do here is we're trying to affect the inside portion of the knee by treating the outside portion of the leg, distal leg, okay? And here's the reason why. I hope I can make this clear to you. If the outside portion of this leg gets very, very tight, and watch the skin of my knee, if I was to pull up and away, you see how my hairline just kind of moved up and out, right? So if I do that, that's essentially what happens when this gets really tight right here. If I do that, I can disturb some of the tracking portions of the knee, and that could cause some of that anterior or some of that medial inferior knee pain. So here's what we're going to do. We're going to take a rock blade. This is actually the new Mohawk, guys. Check this one out. Super cool. It's one of my first times I got to use it myself. So anyway, so then what we're going to do here is we're going to just go ahead and notice that I have no emollient on the blade or anything like that. This isn't going to be a long scraping technique or anything. All I'm going to do is allow the blade to make contact. I'm going to have a little bit of pressure here, right? And holding that skin, I'm basically going to do a dry technique where the actual instrument itself is not moving. See, I'm not doing this. Making contact with the skin at that tender spot, whichever one I find, right? Keeping that skin, I'm basically jostling that skin motion back and forth. Maybe at the very end I get a little bit of movement on each direction, a little bit of movement, but it's very minimal, okay? So what I'm doing is using the instrument to create a bigger swath, to collect more tissue as I jostle back and forth, and also get some depth and penetration right here, okay? So what I want you guys to be able to do is do like a little retest, right? So if you're that person that has that with that terminal knee extension, that terminal knee flexion, you get a little bit of that pain there. All we're going to do is go to the outside. If we have tenderness, and we do have tenderness, we're going to take an instrument, we're going to do a dry technique where we're not adding a whole bunch of emollient. We're going to place that sucker down, right? And we're going to go back and forth whichever way that skin allows me to, that fascia allows me to. All right, I'm just going to go back and forth, trying to increase the ability for that tissue to glide past each other. We'll do it for about 10, 15, 20 seconds, right? And see if you have a positive result. And if you do, this is going to be a good way that we know where we're treating. So inside knee pain can be treated with the outside of the leg. Questions, comments, please post them below. And until tomorrow, we're optimizing function to optimize performance.